Good morning, everyone. Thank you for joining us today. This workshop that you are in is number 15, the Climate Action in the Midwest, centered in environmental health justice, and there's going to be a screening in-panel discussion of Unbreathable, the Fight for Healthy Air. So this is a 1.5-hour workshop, and so we're going to conclude at 12:30 p.m. If you are looking for a different workshop, now is your chance to relocate. My name is Ella Hyman. I use she, her pronouns, and I am an intern for the Midwest Climate Collaborative as well as a sophomore here at WashU. And I have just a few housekeeping notes before we begin. So before getting started, I want to walk through a few items both for the people in this room as well as our attendees joining via Zoom on the Whova app, excuse me. If you are joining us online, please keep your microphone off until ready to ask a question. And we're actually just going to be doing all of the questions for people that are virtual through this app, so you will not be unmuting at all. And I will be monitoring the chat. There are a few ways to interact during the session via the app. So if you look at the left-hand side of the screen, you will see several tabs that include the question and answer section, which is a chance to submit questions to the presenters, polls where you may be asked to respond to questions from the speakers, but I don't believe there are any polls in this session. The chat, which is an open chat room tied to the Zoom chat where you can interact with the presenters and fellow attendees, and the community tab, which allows you to interact with the full audience of attendees at the summit. There will also be a recording of this workshop available in the next few days on the app, and all of the content from the summit will be available for the next 3 months on the app. For anybody who is attending in person, we will be running our mic around the room, and so you are able to just ask your questions live. Again, like I mentioned, I will be monitoring the Q&A and chat sections of the app, and I will help field questions for the speakers. With that, let me introduce today's presenters and moderators of our panel. So Dr. Sylvia Hood Washington is an environmental epidemiologist, environmental engineer, and environmental historian from the North Carolina State University. Beth Gutzler is the lead environmental justice organizer and senior manager at Metropolitan Congregation United, and Laura Turner is an advocacy with the American Lung Association. They will all have longer bios in our app if you'd like to read more about them, and we are just really excited to welcome you all to the session today. Thank you.
Hi, I'm Laura Turner, and also wanted to welcome you. She, her pronouns. I'm with American Lung Association. I'm the senior manager of advocacy for Missouri and Arkansas. And just wanted to give you a little intro about this film. Unbreathable, the Fight for Healthy Air is a timely, powerful look at 50 years of the Clean Air Act and the challenges we still face to ensure healthy air for everyone. Weaving historical milestones with current-day stories of environmental injustice, the film is an excellent tool for educational and community engagement. So hopefully you all can have some great questions to ask the panelists, but I think we can go ahead with the film and enjoy.
The air that we breathe affects us deeply. It affects our bodies. It affects us with sicknesses.
Nearly half of Americans breathe unhealthy levels of pollution today. And it's not just the obvious ailments like asthma and bronchitis. A strong body of evidence now links air pollution to heart attacks, birth defects, cancer, dementia, and to an increased risk from respiratory viruses, such as COVID-19.
There are 4 million kids that get asthma every year just because they live in close proximity to a major roadway. We have to do better than that.
The air is no good to breathe. My wife has sarcoidosis for breathing this stuff all of her life. Most of the people in this city are affected by respiratory diseases.
There are a number of zip codes across the country where right next door could be a different zip code, and people will have 10 years, 11 years, 12 years shorter lifespans.
50 years ago, growing public outcry over the dangers of air pollution helped push Congress to pass the Clean Air Act. It was the strongest, most comprehensive federal public health law ever.
There are few pieces of legislation that affect everything you do all day, like breathe.
It's a human right to breathe clean air, and that right is being violated right now.
Before the Clean Air Act was in place, we literally had cities that you could be in and you could look up and not see the sun.
It was a time when pollution was so visible that you didn't have to prove it was a problem. You could see the smokestack spewing black smoke. You saw the cars smelling terrible. And so the pollution was a visceral experience.
The air was killing people. In 1948, a 4-day smog killed 19 and sickened 7,000 in the small town of Donora, Pennsylvania.
After Donora, there were a number of actions that happened in response.
The one positive thing that came out of it is it really kick-started people starting to pay attention to these issues.
There had been air pollution statutes in 63 and 65 and 67, and the deteriorating conditions suggested they weren't working. The promise of clean air was in those earlier statutes, but the regulatory tools to deliver on that promise were not there. There was a lot of testimony from citizen groups, organizations that were very concerned with the condition of air.
That was really when the environmental movement really kicked into gear.
In the mid-1960s, Senator Ed Muskie led the effort to pass America's first air pollution laws.
We know that long-term, low-level exposure to polluted air is unhealthy. We know that air pollution can kill crops. It does a lot of other damage.
Congressional aides Leon Billings, a Democrat, and Tom Jorling, a Republican, worked with a bipartisan committee to create the Clean Air Act of 1970. It had strong support from both parties.
If this nation could build the bomb, an extremely complicated undertaking, cleaning up air pollution was a relatively easy task. 1969 was the year of the landing on the moon. So you had sort of a collective attitude.
Surely we can move confidently now to achieve a better, more peaceful life for our fellow humans here and throughout the planet Earth.
These things can be achieved if people are given direction, and we can rely on that creative spirit, that entrepreneurial spirit to produce those changes.
In 1970, President Nixon signed the landmark Federal Clean Air Act into law and created the Environmental Protection Agency to enforce standards.
What was Muskie's genius was you had to establish scientifically what the measure of health was for each contaminant without regard to cost or technology.
The decision to put Americans' health above companies' profits was the beating heart of the bill.
Los Angeles in the fall of 1971, and as we dropped down into the LA basin, we saw the smog that was hanging over the basin, and it was a very peculiar orange, I've called it day glow orange color, and it was ugly.
Mary Nichols was fresh out of law school when she arrived in Los Angeles to join the fight for healthy air.
I found a job within my first few months working for a public interest law firm called the Center for Law and the Public Interest. We knew then, and it's still true today, that the most important source of air pollution is motor vehicles, cars, trucks, and other things that move. And that not enough was being done to bring new technologies online that would clean up the fuels and clean up the vehicles.
Nichols was just 27 when she filed the first lawsuit under the Clean Air Act.
Look at them. A couple of new areas that we normally don't get. Here's on the second page. Take a piece, get this. The coastal areas, of course, do, and the Hemet.
When I was a kid, you couldn't go out and play because the smog was so bad, and they would have smog alerts to urge people to stay indoors.
Henry Waxman from Southern California was elected to Congress in 1974. His determination to defend and strengthen the Clean Air Act would earn him the nickname Bulldog.
The automobile standards that were set were national standards. California had the ability to set even tighter standards, and some states could pick up the California standard.
Eventually, 13 other states would adopt California's stronger emission standards and move forward with innovative technologies that began to seriously reduce air pollution. Between 1970 and 1990, the Clean Air Act would dramatically decrease pollutants across the country, and America's improved health generated over $22 trillion in economic benefits. But the federal regulations still left enforcement largely up to individual states.
One of the real problems with the way that the Clean Air Act has been structured is that the authority is delegated from the federal government to the state. Now, in general, of course, that would make sense, right? That the government on the smaller level could more effectively manage a program. But when you're talking about a state like Louisiana that is absolutely captured by the oil and gas industry, that model, that setup is a disaster.
This girl, Sylvia Mama, was living here. She died with cancer. This guy right here died with cancer. This lady right here, she's sick, but she don't have cancer. Her husband died with cancer. This lady right here, she has cancer.
In 1969, a year before the Clean Air Act was signed into law, chemical giant DuPont Denka announced it would produce neoprene at its plant in Louisiana's St. John the Baptist Parish, west of New Orleans.
This girl right here, Carol Lennox. Carol Lennox and I went to pre-K all the way through high school and remained friends all our lives. And when she died, took something out of me because I knew how hard she had suffered. She had so many illnesses all of her married life. In fact, she had even filed a suit against Denka years back before we even thought about what was going on, because she and her kids were sick. And she knew it was the plant that was doing it to it.
Reserve is in a cloud that you can't see the sun through. I think the spirit of people in reserve feel that they have this defeated feeling that's almost innate.
In December 2015, the EPA released its National Air Toxics Assessment, and that assessment revealed that Census Tract 708, where the Denka facility sits, the residents of that tract have the highest risk in the country of getting cancer from air pollution. And the National Air Toxics Assessment also determined that that risk of getting cancer from air pollution is coming from chloroprene, which is a chemical that is really only emitted by the Denka facility.
I was 4 when they started emitting chloroprene, to my knowledge. And I know that my generation, we started suffering with allergies. My brother had nephrotic syndrome, kidney disease. And our children, they were all born with asthma, upper respiratory problems all the time. So it was like the next generation just got worse.
The rate of cancer has been so high for so many years around the DuPont Denka plant that people call this area Cancer Alley.
DuPont Denka! Stop killing our babies! DuPont Denka! Stop killing our babies! DuPont Denka! Stop killing our babies!
We have implored DuPont to at least reach what EPA says is a safe level. They have refused to do it. And based on that, they need to stop production. We need to have them shut down since they refuse to respect our lives enough.
Concerned Citizens of St. John is an organization that was formed to fight the environmental injustice of our parish.
We need them to stop producing the neoprene that causes the release of chloroprene, or they need to come down to the levels suggested by EPA. They need to meet the guidelines, or they need to shut it down. And it's not gonna devastate this parish like we've been told, or people are led to believe, because in essence, it's not really supporting the community that it's in.
And the street next to, on the fence line of the plant, there's more vacant houses, I think, any of the streets here. These people are just dying, and nobody's gonna move back in there. We can't sell our homes, because who wanna buy a home in Cancer Alley when everybody's dying out? Nobody wanna come back and live here. So all we want the plants to do is make it safe for us so that we can live here.
Well, these acres now are toxic. And it's not fair for people who only have a little to hold on to. And our lives mean nothing, because as long as we're a small minority community, we don't really matter. It's devastating. It's heartbreaking.
Early on, it became clear that key to enforcing the Clean Air Act was understanding how to measure air pollution and its health impacts.
In 1970, the way you enforced the earlier Clean Air Act is there was a card, a 3x5 card called the Ringelmann chart. And the way an enforcement person would hold that card up against a plume, and if the plume matched the far end, it was very dark, that was in violation.
Scientific and technological advances provided better ways to measure pollutants, even ones that were not so visible, like the sulfur dioxide that causes acid rain. Acid rain was plaguing the Northeast and parts of Canada, killing trees and poisoning lakes. The culprits were Midwestern power plants burning high sulfur Appalachian coal. Despite the evidence, President Reagan and Congressman Dingell were determined to roll back regulations.
John Dingell from Detroit proposed a bill supported by the new Reagan administration at the time, which would have destroyed the Clean Air Act. It was a gift to all the polluting industries. So our first fight was to stop that legislation.
Over the next few years, Waxman continued to push for stronger regulations and enforcement of those regulations without much success.
The hospitals in Bhopal were overwhelmed by the catastrophe.
Then, in 1984, a toxic leak killed thousands of people near a Union Carbide pesticide plant in Bhopal, India. Waxman quickly spread the word that Union Carbide was producing the very same lethal gas at its plant in West Virginia.
Utilized at the Union Carbide plant in Bhopal, the same as the safety features and procedures used in Institute.
Good evening. The Union Carbide sister plant to the one in Bhopal, India, which experienced a gas leak last year, killing 2,000 people, today had a major chemical leak at Institute, West Virginia.
If it's about you, your family, your kids, you will demand that the federal government step up.
Whenever there were efforts to change, roll back, stop advances, environmental protection, it has been the health issue that has rallied people.
In 1990, Congress agreed to strengthen the law on toxic air, acid rain, urban smog, and other forms of pollution.
We passed a revision of the Clean Air Act that had almost unanimous support, clearly bipartisan support, both in the House and the Senate.
1990 is now a milestone year for the environment, and I also hope that it will be remembered as an important year for environmental cooperation. Today, I am very proud, on behalf of everyone here, to sign this Clean Air Bill, Clean Air Act of 1990.
Well, the measures of attainment in those days were more relaxed than they are today. The Clean Air Act amendments strengthened them quite significantly, and they've been strengthened further since. But even then, large parts of the country had very severe, pervasive, continuing problems.
When you drive in, you're coming down through residential neighborhoods, and at the bottom of the valley is this enormous area of industrial development.
We have had coke making and steel making along the Mon River for, over 100 years.
U.S. Steel's Clairton Coke Works is the biggest coke making facility in North America. What happens with their plant affects the entire region.
We hear a lot of complaints in terms of air quality here. People will say, I smell a rotten egg odor or a sulfurous sort of match kind of smell, or a chemical odor. And people are concerned because if you're smelling it, you're obviously inhaling it, and then people wonder, well, what might that be doing to my body or to my children? Children have been diagnosed in the Pittsburgh region and the Mon Valley with a rate of 22% for asthma. So it's nearly 3 times the national average. So if we can clean up the air, hopefully that will result in less asthma attacks and less children being diagnosed with asthma.
But instead of getting better, things got worse. On Christmas Eve, 2018, there was a major fire at the Clairton Coke Works.
Now neighbors near the Clairton Coke Works showing just how frustrated they are about a fire there. It sent chemicals into the air that they were not told about for weeks.
How long are our kids going to be expected to play inside? And why should they be expected to play inside? Who is tracking our health and what system is in place?
There's a problem in Clairton, but there's a problem all around this area because this pollution travels.
The health department really didn't inform the public about the situation until about 2 weeks later. For 2 weeks, they knew that something was happening at the facility. They knew the air was especially dirty, but they didn't really have the details.
And U.S. Steel spent over 3 months fixing those operations, and they continued to make coke the entire time, refused to put their plant on idle so that they wouldn't be producing nearly as much pollution. U.S. Steel can say they've been here for 100 years, but it's time they actually treated what they do as actually mattering to the community and not mattering to just their bottom line or just the people who work at the plant. Where the Clean Air Act has done a lot of good to a lot of people, but it is not equal in terms of how people have benefited, and that's the undone business for the Clean Air Act.
In 2006, the threat of global warming was making headlines. Scientists had proven that the burning of fossil fuels was creating carbon emissions and seriously destabilizing the health of our planet. The effects of climate change were threatening public health in unprecedented ways. There was more at stake than ever in the fight for healthy air. Under Republican Governor Arnold Schwarzenegger, California became the first state to pass a Global Warming Act.
We passed that bill that said that we're going to reduce greenhouse gases by 25% by the year 2020. When we signed that bill, there were environmentalists, Democrats, car manufacturers, and business people. We didn't sit down and say, I don't want to talk to you. We sat down long enough to figure out what they would like, what the Democrats would like, and what we as Republicans would like. And how do we get the business community on board?
In 2007, the U.S. Supreme Court made a critical ruling. It determined that greenhouse gases fell under the Clean Air Act and must be regulated by the Environmental Protection Agency to prevent harm to public health. Over the next 8 years, President Barack Obama used the Clean Air Act to set higher federal standards to limit air pollution and to promote alternative energy technologies.
From the cars and trucks we drive to the homes and businesses in which we live and work, we've changed fundamentally the way we consume energy. Now keep in mind, the skeptics said these actions would kill jobs. And instead we saw, even as we were bringing down these carbon levels, the longest streak of job creation in American history. We drove economic output to new highs, and we drove our carbon pollution to its lowest levels in 2 decades.
If you look over time, we've made great strides under the Clean Air Act. Our air quality has improved, pollution concentrations have gone down substantially, and we've realized the health benefits. Going forward, really our job is to strive for making our air even cleaner and even better for ourselves and for the children that are here today and for the next generation to come.
People in general have a great deal of faith, which I think is actually well justified, in the ability of American industry to come up with technology solutions when they're put to the test.
In the past decade, use of fossil fuels has decreased, while use of renewable energy technologies are steadily increasing.
We've got to go to an all-electric society through solar and wind. That's the future. You have to be blind not to see that future. It'll also not only produce benefits for climate change, it will meet the health standards in a hurry.
You have certain choices. And the choices are, if you buy a car, think about it. You maybe want to buy a car that is an electric car or that is a hydrogen car rather than buying a fossil fuel car. They're now very inexpensive already, and there are really great looking models out there, not like in the old days where they look kind of goofy.
In order for a law like the Clean Air Act to work, it takes government at the federal and the state level, it takes business and industry throughout the country, and it takes citizens pushing in the right direction.
In this moment that we're in, we can either be pessimistic and feel the gloom and doom, or we can get really focused on what we need to do to make change happen, bringing people together, thinking innovatively about policy, but also thinking about technology and how it has to play a role in the change that's going to happen, but also making sure that we are giving power back to the people.
Today, communities across the country are taking action to fight for a cleaner environment. Baltimore's Curtis Bay has some of the worst air pollution in the nation. When a group of high school students learned about plans to build an incinerator plant near their school, they had something to say.
There is an incinerator plant to be built less than a mile away from our school, Ben Franklin. And I think as a community, we can all stop this. So let's come together. Whose city? Our city.
It was hurtful that like someone already made a decision for us without even giving us the decency to tell us about the decision. That was like eye-opening to us that we did not matter and that we were truly a dumping ground community, to the fact that even our voices, our input on things didn't matter.
The students formed a community action group called Free Your Voice.
Is it fair to build the nation's largest incinerator in a community with the highest level of toxic air emissions in the state? Is it fair to have your life cut short because of where you're born? We say that it's not fair, that it's not right. The incinerator is failed development.
After 3 years of campaigning, Free Your Voice convinced Baltimore City not to build the incinerator.
We have a role of standing up for our community, whether it's us coming together when we can and really fighting back like we have been doing. That's the role that we've been put in, and that's what we did back then. Now we're coming up with solutions.
This is our future, you know? We have to take care. We see things in a different way. We have a cleaner vision and a way better vision.
If people can see that youth are capable of doing something or being part of something greater or a greater cause, something that will benefit not just us, but like our neighborhoods, our planet, the air, everything.
When we come together, we can win. And that there is no problem that's bigger than us. Because when we all come together, we're pretty big. We want the best for our kids and our futures. And so, to get that vision, we have to fight for it.
Thank you. At this time, I'd like to invite our panelists, Dr. Sylvia Hood Washington and Beth Gutzler, to come up and make yourselves comfortable. And if everybody wants to be thinking of questions they might have, I'm going to get the conversation started with some questions I had put together, but we want to make sure everybody has a chance. So. Hello? There we go. All right. And thank you to everybody who was able to join us in here and virtually. So I think Ella, wherever you there, is going to be monitoring the virtual question and answers, and what we're going to do after I kind of get our discussion started is kind of alternate between people in here asking questions and people virtually asking questions, so we got a fair representation of everyone. So pretty powerful film. So I wanted to start off with Dr. Washington. Should I call you Sylvia?
Sylvia.
Okay, I know you like to be called Sylvia. So in your experience working to enforce the Clean Air Act, What aspects of the Clean Air Act are particularly relevant to climate change?
So I really was fortunate to start in industry enforcing the Clean Air Act. And I had an opportunity to spend 1 year as a plant environmental engineer for the Lakeshore plant in Cleveland, Ohio, off Lake Erie. Part of the enforcement of the Clean Air Act is particulate emissions. That's relevant to climate change, which they brought out in the film. So when you have these particulate emissions, these little particles that break down after you combust coal, especially, that's in the air. And that density of particulate emissions increases with changing temperature. So that's going to make people who have problems breathing have even more difficult problems as the temperature increases. It's going to keep it's going to increase the density of the particles. The other part to the Clean Air Act, which I didn't really hear in this film, is the development of ozone, which will also exacerbate health issues. So the Clean Air Act is very powerful for particulate emissions and for ozone, which we know will get steadily worse and is getting worse in terms of health outcomes for those with pulmonary problems, asthma, chronic obstruction, pulmonary disease. And he did touch on it. A lot of people don't understand that those particulates, which are managed by the Clean Air Act, are devastating to individuals with cardiovascular disease. So we think about asthma, that's like it makes a connection because they're breathing, but very few people understand that those same particulate emissions are also making the heart work harder. And so people who study epidemiology and the epidemiology of chronic diseases, not infectious diseases, when I did my MPH almost 15 years ago, it astounded me that some of the highest rates of cardiovascular incident is when an individual is driving their vehicle or in a vehicle traveling and being exposed to particulate emissions from the combustion products of cars. So I mentioned cardiovascular disease yesterday. I mention it again, especially when we talk about air pollution.
Thank you. That's really good to know. I mean, let me ask you that, if you know this, when you talk about the people in the cars being exposed more, so recirculating your air, does that help? If you can get to it before.
So you also know that I'm an engineer. So the importance of the new technologies in cars, and I know this from personal experience, as well as being an epidemiologist, is as we were trying to transition into hybrid cars, newer technologies, the cars started developing better filtration systems. And so if you're in a car that was built before the manufacturer decided to put in these new filtration systems, you had a much higher risk of having that cardiovascular event. So you want a newer vehicle with a manufacturer who has taken into consideration the fact that they're trying to protect their passengers from these particulates coming into the car. So that is very much part of our automobile technology and automobile engineering. The most responsible manufacturers have built in these air filtration systems. At one point in time, I would say the late 1990s, early 2000s, you had to buy a BMW or a Mercedes to get that level of cabin filtration of air. A poor person could not afford that. With these new incentives to increase and improve automobile technology, it's becoming a standard feature. And that's what we want. So I hope I answered your question.
Yeah, I did not know any of that, so thank you. Hopefully that was enlightening for everybody too. You're a wealth of knowledge, so I always learn something talking to you. So Beth, I wanted to ask you a question, and then I'll let everybody else have a turn, because I don't want to hog all the fun. So, and Beth, if you want to talk just briefly about what your role is at your organization, in case anybody didn't remember from the intro that Ella gave, then that'll kind of give some context to the questions I have. Yeah, what is your role at your organization?
Yeah, so currently right now with Metropolitan Congregations United, we have started an environmental justice campaign as a way to bring faith communities to actually put their values into action and do that through environmental justice work. So as the lead environmental justice organizer, I continue to network with congregations and their leaders to start taking action.
Mm-hmm. Great, thank you. So what sort of, that really naturally leads into this question, what sort of community organizing around pollution and or climate change have you been involved with?
So it was sponsored by a grant and in partnership with Jay Turner's Lab at WashU, but we wanted to get churches involved in first monitoring the air. There was a need to have a consistent location to be able to put monitors up. And then there was also the desire to have people do something with the data. So our first project started with particulate matter 2.5, and we have those monitors up in 14 congregations still today. And other congregations are turning to other monitors types to look at particulate matter 2.5. And I think we've really started to tap into connecting their personal stories and personal experiences to what's going on in the air qualities. And we're at the beginning of getting those individuals to get more involved, like you saw in the video. Go and actually give their personal statements at our local, here in St. Louis, here in Missouri, committees, hearings, even your local planning and zoning, like you saw in the video, standing up for what they believe in reference to air quality.
Can I answer that question?
Yeah, please.
So, although I started in industry as an engineer and a chemist, I had the opportunity in 2002, after I had finished my PhD, to run a national program on environmental health and environmental justice that was funded by the U.S. Conference of Catholic Bishops, Environmental Justice Office under Walt Grazier. And I had the opportunity to create an oral history project of African Americans living in Chicago to document their environmental health struggles. We created a film called Struggles for Environmental Justice and Health in Chicago, an African American and Catholic perspective. And working with Dr. Lonnie Bunch, who was like the first head of the African American History Museum in DC under the Smithsonian, he trained our African American Catholic youth to do oral histories of the community, to document these issues of environmental disparities. And we end up focusing on asthma issues tied to unregulated or a power plant in Chicago. We also had an opportunity to interact with the Hispanic groups in the Pilsen Little Village in Chicago. They were really struggling with emissions from 3 unregulated grandfathered-in power plants. So this idea of faith-based initiative for environmental justice goes back over 20 years. As a consequence of my project, which ran for like 4 or 5 years, we were able to elucidate and to engage the community within parishes and at regional conferences with African American youths ages 12 through 18. And I think that was a very powerful thing to do, because by bringing experts from UIC School of Public Health, from Notre Dame's environmental studies programs, we were able to get the community, teenagers and adults, to understand the environmental impact of air pollution on them. And I think that the role of the community and community engagement outside the academy is extremely important, and I really admire what you're doing, especially with the testing stations. But that was done, we did that over 20 years ago, and received several $100,000 for the Catholic Coalition for Children in a Safe Environment through the USCCB's Environmental Justice Office. And I actually have to acknowledge that project because it was transformative.
Okay. So how would we, the people in this room, our communities, our organizations, how would we go about replicating something like that? Because I know it can be quite powerful to get youth involved. And I'm sorry, my phone is going off. There we go. Or do you think it's something that you would have to have all that funding to do?
I like the fact that BEF is being supported by the university.
Mm-hmm.
Because it takes multiple partners. If I had to think about what we experienced, we had the support of the Chicago History Museum, we had the support of universities, we had funding, but I think what broke down for us, lesson learned, is that when we finally did have even a bigger pot of money, the universities that were supposed to support us backed away for political reasons. Once you have an academic institution committed to ensuring environmental health equity, the project will move forward. For example, if you think about Peggy Shepard, the West Harlem Environmental Action Group, WEACT in New York, powerful alliance between that community group, WEACT, and Columbia University that is 20 years long and have made tremendous impact on the community. When I think of another colleague of mine who's also related to me, Catherine Coleman Flowers, who's now a MacArthur Genius Grant in Lowndes County. The EPA administrator mentioned yesterday. She didn't mention Catherine's name, but I whispered it to her. Catherine Coleman Flowers is aligned with a religious organization under Al Gore's daughter in New York, religious-based organization, but now Duke University has been supporting her work. She's now practicing, scholar there, and so she's leveraging the university, leveraging a religious organization, and having the community involved. So I think that partnership between academia, NGOs, whether it's religious or non-religious, and the community, a solid partnership is what advances health equity, environmental health equity.
All right, so I'm going to stop hogging all the fun. And if anybody in the audience wants to, I see a hand already. It's your turn. There's actually a microphone for you if you could.
I can project. I know during the Trump administration that EPA's power was rolled back. What has been done since Biden's administration to give them the power to enforce the laws of clean air?
I just want to highlight that there is a presidential initiative, Justice 40, that is being woven into our conversations around what it looks like to receive federal funding. This is something that I think has been a positive, and I would like to see not just be a presidential initiative, because there are key elements that support what we've been talking about, which is the regulation to have community agreements, to have community involvement before certain things are done, and to have investment into those impacted communities. That's what 40 means. 40% has to go back. So specifically, those are some things that need to not just be a Biden administration action, but needs to be a thread that's continually in our conversations about environmental justice. And with the Missouri Senate Bill 681, some of that language actually was able to be done last year for the first time that I know of.
So I'm gonna say this much because I feel like I've been around for forever. Sorry. I remember when I got hired, Jimmy Carter was president. And I pray for him now as he's going through these health challenges. And everybody was excited. I was in the power industry. We were trying to comply with the Clean Air Act, the Clean Water Act, Resource Conservation Recovery Act. That was January of 1980. By November of 1980, we had Reagan. And he transformed the environmental regulations. And then we had Reagan, and then we had the first Bush, and then we had Clinton. In all of that, the community was still suffering. So community engagement, community education is powerful regardless of administration. If the community doesn't understand what's happening to them, regardless of your president, they cannot make the choices on an individual level, regardless of who's in office, and regardless of the regulations. One of the things that we saw when we did our project, we were doing our project under Clinton, and we were still dealing with unregulated power plants that had been grandfathered in the Chicago South Side. Democratic president, unregulated, grandfathered in clause for these power plants. And people were still dropping. Their levels of mortality and morbidity were off the roof tied to air pollution. So it's not about Trump or Biden. It's about education and understanding what's happening to your environment and being active at the local level and regional level to affect change. That's how I will answer you as an environmental historian and as an engineer who was on the other side in industry. Because industry knows the landscape, the political landscape for environmental enforcement, unfortunately, a little bit better than the layperson who is on the receiving end of their pollution production, if that makes sense.
And I just want to briefly add to this, not that there's much to add at all, but right now, y'all may be aware that the EPA is reviewing a lot of their standards for the National Ambient Air Quality Standards. Things like particulate matter, ozone, mercury, lots of other air toxics. And they're accepting public comments for that. So I actually testified yesterday on the particulate matter one, and you can submit written comments for that. So that's a way that you can be involved. This is going to be ongoing. We really just need to pressure the EPA to have stronger standards before they even get enforced, while we can. So if anybody's interested in that, I'll probably share some information on the app for anyone who wants to get engaged in that way.
I'm not seeing any questions on the app as of now, and so any other in-person questions? Yes. And also, if we can just wait for the mic, because there are people on Zoom.
Hi, thank you. I'm curious from your perspectives, because I have a background in public health and work for a managed care organization today, which serves Medicaid members. What role do you see in the future? What roles would you like to see from the healthcare community, including providers, health insurance companies, and beyond, really? As we know, that can be impactful from the member health outcome standpoint and also the supply chain and the emissions aspect of that as well.
So as an epidemiologist and a person who's into data science, we're talking about personal and population health. And so what has to happen, what should be happening, is that on the personal level, we should be documenting and collecting data on patients. We should have a surveillance system that literally tracks these air pollution-linked diseases, morbidities, and mortalities to that individual and to their geography, so that we can have a larger picture. So that's the personal, collecting the surveillance data, on individuals for asthma, chronic obstructive pulmonary disease, cardiovascular disease. How did that event take place? What triggered that event? What are your, how are they coding that so that we can track it within surveillance? And then create that database and then have it linked to our environmental factors. Like, was there, when we had a huge event of asthma reports to the hospital that day, was the power plant that was within a 30-mile geographic radius in compliance with the Clean Air Act? Okay? Because if they emitted an extra plume with higher emissions, and we know that these plumes with particulates are triggering the event, then that needs to be documented. Then we can do a comparative analysis between that plume that was created within that 30-mile geographic radius, and then look at other events outside the 30-mile geographic radius to see that there were no asthma triggers. There was no increase in asthma events prevalence in that cycle of period. Does that make sense to you? So I'm always going to go back to data. We're not collecting the data. And we're not collecting the data purposefully and integrating data from all these sources that we're collecting. In the 21st century, that's appalling, because you can collect that data now very quickly.
Yeah, I'd like to comment that another data track that I would like to see is, and an opportunity for the health industry, is relating environmental issues and environmental justice concerns to mental health. Mm-hmm. Because unless the people who are impacted by these policies, by these admissions, have access and affordable access to mental health, are we not going to be able to also continue to track that data and say that it is traumatic to have your child in the hospital? Mm-hmm. It is traumatic to, be able to suffer from cancer, and is that related to an environmental issue? We can't, from what I can tell, be able to make those connections at the moment. So it's an opportunity. And then also just the idea of how it connects to other things. So in our work, we try to talk about, and even now at the larger national Gamaliel level, how environmental justice connects to other social justice issues, with being out of school for health issues, having impacted family members with health issues. And if this can be tracked to an environmental cause, then that's some role that the health industry can play.
One of the phrases that they use in public health is social determinants of health. And I think what she did, she's articulating that. Years of life lost. I mean, how many years are being lost within these communities, EJ communities, from these environmentally linked diseases, right? If the average lifespan is 82, but you live in an environmental justice geography with unregulated power plants, now the lifespan is not 82, it's 50. Are we tracking that data so that we can make a different policy argument for a proper regulation? Disability adjusted of life years. How disabled do you become living with this environmentally linked, air pollution linked exposure? How fruitful is your life? How much of your lifespan has been compromised, and therefore your ability to work and be economically productive? This is information that we can gather today, if we choose to. This is not just about politics. This is about actual living persons whose lives are being compromised and whose lives are being brought to an early end because we're not examining the data that shows that these lives are being compromised with this type of pollution. And I think we should start thinking about doing that.
Just to kind of piggyback off of that question, when we talk about the role of healthcare providers and the data gathering process that seems to be a recommendation, are we envisioning that healthcare providers will be the hub for that data collection and then that data storage? This might be a hard question.
You have CDC, who's been collecting data. They have all these databases that's been running for 100 years. This is not going to be anything new to them. They're already collecting data, but it's how they're integrating the data. So I don't think we're asking for anything. We're not asking for anything to be invented. We're just asking for something to be improved in how you use it.
And I think it goes beyond that, because it's one thing to track it, and then it's another thing to actually use the data. Mm-hmm. So one of the things I've learned through my work is the way our current permits for air quality are done in the state of Missouri. And so it's all in the news now about algorithms and things of that nature. So it's really important to continue to think about what modern day policy change would look like. And the idea that what software system are you using to calculate? What algorithm are you using? Mm-hmm. If we collect that data, is that even a policy that's going to be implemented in time to hold the permitting process accountable, or the companies that are receiving these? I like to always say permission to pollute my air. We've got to have all of the steps in place to make it effective.
Thank you. Not seeing anything online.
Thank you. I just want to mention or comment, is there any initiative for doctors being trained that this social justice and these environmental issues that are related to health situations, that this could be a change that could be incorporated, that this, this is the new generation that is being aware of this is it's such a magnitude. So is there any change, any initiative for training doctors, nurses, to see this in a different way?
We have to be fair to how doctors are trained. Doctors have to get an MPH to get further into the causes of like pollution and health outcomes. That's your master's in public health, in epidemiology. There's a master's in public health and environmental health sciences. So that training has been ongoing for decades. But doctors are not required to get an MPH after they finish medical school. That's not their training. They have to go for that additional training. So they do understand it, but in terms of that integration of these issues, that's what you get for your master's and PhD in public health for doctors.
To add on to that, it's not necessarily training, but what we've been focusing on at the Lung Association is engaging in advocacy, health professionals particularly. We have an initiative called Health Professionals for Clean Air and Climate Action. And so that's something that we're using whenever the EPA is setting new rules or limits, or there are any issues that can be spoken out against or a letter sent. We try to get a very strong representation from each state of not only lay people, but separately health professionals, because that health connection can be so powerful. And it's kind of our lane, that little health. If you couldn't tell from this session, the health and climate and air pollution connection is so important. But I think you raise an important question about the training. There's definitely a gap there.
To answer that question, my name is Sonia. I'm a third-year medical student from Ohio State, and I'm here because I'm very involved with our sustainability club and particularly our curriculum committee. And so I think it's very school dependent. It's not a requirement, like on a national level, for medical students to receive training about environmental health, which we see as a huge issue. So I think there's plenty of organizations, but it's really student-led initiatives. And we at Ohio State are really trying to incorporate environmental health and throughout our entire curriculum. So we're working on it, but I can't really speak to all other medical schools on a national level. And I think certain specialties like pulmonology and emergency medicine too are particularly interested in these effects, and we're trying to promote some like environmental justice measures and at least increase awareness for medical students because it is a huge problem, and we are lacking a lot of education there.
So at the University of Illinois Chicago, there is you have the Environmental Occupational Health Sciences Division, but you also have an Environmental Occupational Health program tied directly to the medical school. There's a program, and then there's an actual institute. And so the School of Public Health has been working directly with the medical school. There's like a children's environmental health network that's out of UIC and combined with Russ. So you have medical faculty between the School of Public Health and a medical school, but these programs they have coalesced because it's not part of the normal curriculum. My daughter is a military physician at Walter Reed Hospital, brother-in-law who's a physician in San Francisco, 20 years difference. And when we have these conversations, 20 years apart in training, they're saying the same thing. This is not what we're trained in as our traditional medical school curriculum. You're not. But organizations that are trying to create programs and having conversations help them, but I was trying to get back to the original. That's not part of their traditional training.
I would just like to comment that I think that what's emerging is not just in the medical field, but in all different agencies is this conversation about environmental justice, this conversation about air quality and our public health. For me, it's even gotten down to conversations that I've had with food pantry workers that run a food pantry or a homeless shelter. What does it look like to add environmental justice factors to your intake form? When I think about, this is water related, but when I think about there are special school districts and what boxes are checked when we're first starting to think about a particular student that might go into the special school district, is environmental justice, is their exposure to air quality issues even a thought in the mind before we talk about something else, before we certify someone, before we think about why certain things are happening in our communities. So that's we call it a narrative shift. That's the conversation I would like everyone to be having.
And the sad thing about what you just said is that the environmental justice movement began in 1978, 1979. And they've been trying to advance this discussion about environmental justice and its impact because let's face it, and that starts in North Carolina. Environmental justice movement starts in North Carolina because of polychlorinated biphenyls, PCBs being illegally dumped in these communities of color that were poor. And I would say that, oh my gosh, that's like 45 years ago. They've had environmental justice summits, at least 2 or 3. So we're still trying to advance a concept. I think the beauty of the Clean Air Act, 1970, we had legislation, bam. I mean, we're talking about Rachel Carson, 1962, Silent Spring, and then we have the emergence of the Clean Air Act in 1970 within 8 years. But the environmental justice did not get that kind of historical evolution. So now we're 45 years out, and we still don't have legislation to protect these communities. What the argument was on Earth Day 1970 by elected officials, the first Black elected officials, is that they did not want to support the environmental regulations because they said in 1970, Earth Day, They protested. They went to Congress and protested. They said, why are we doing this? When the issues that are facing our community is not about whether the sky is cloudy. The issues for us is, can our people live in that? So they were arguing for human resiliency in 1970. Environmental justice is about human resiliency, not aesthetics, human resiliency. And those two movements merged in the 1990s because traditional environmental groups began to understand that there were human beings who were actually dying and suffering and having reduced lifespans and compromised lifespans because the environmental regulations that had been created were not being equally enforced. That is the definition of environmental justice.
Thank you.
Hello, my name is Metric. I'm from St. Paul, Minnesota, with the organization Community Stabilization Project. One, I want to say in Minnesota, health has been declared as a racial disparity. But my question is, do you see the relationship from us continuing to be sustainable versus or in complementary to trying to be a regenerative systems and outcome? And my second one, do you see environmental reparations as part of this conversations when we talk about healthy communities and the impact of past practices?
Yes, environmental reparations. That is a word. So I think that it's very important to highlight in everything that's going on that things are not enforced equally. That has to be part of the equation. And I think your question restates that. What it looks like for a reparation might be different for everybody. So for me, my restorative justice background likes to think about reparations may not be money in everybody's world. It might be different based upon the community that's impacted. So I think that's the summary of my comment, is that when I think about how a community should be, I guess reparations is the right term, for an injustice that's occurred, I want the community to tell me, not for legislation or policy to tell me. I want the community voices to say, this is how it's impacted us, and this is how we would feel that justice is served. And that's kind of messy in our legal system.
So I'm an environmental justice historian, so this sort of coming out. So when you had Love Canal with Lois Gibbs, which created the Superfund Act, which helped create the Superfund Act, Lois Gibbs leveraged, like I said before, medical professionals and policymakers, and they were able to get individuals relocated out of the Love Canal area. That's a horrible story. It's a great story you should read about. So that was like a form of reparations, giving people money to relocate. In Oakdale Gardens in the 2000, again, he was dumping the polychlorinated biphenyls. They took a lawsuit against the city of Chicago in conjunction with ComEd for the illegal dumping of PCBs inside a low-income housing community. Inside, children were playing in it. The community was involved, worked with attorneys, and then negotiated a settlement, and it was like hundreds of dollars. But it's sort of horrifying because the genetic consequences of that exposure would far exceed $500 a person. So environmental justice is, the history is just stunning. So what does reparations look like? How do you provide reparations to individuals whose very DNA could have been impacted by exposures to the chemicals? What does that look like? How do you summarize that? How do you pay for that? I don't even want to answer the question because I think it would take a commission to look at not only, it's not money at this point. I mean, that's like generations and generations and generations. If you talk about lead exposure, Flint, Michigan, right? Oh, they can't drink the water. It's more than they can't drink the water. It's the reduction of IQ. It's the impact, cognitive changes in utero and beyond. No one talked about the pregnant women who were drinking the water in Flint. How do you get reparations for that? So I think I'm gonna always come back to education and giving people knowledge, whether they're in the community, definitely in the community, but also policymakers, because I think they have to understand what this pollution is doing and the choices that are available to them to avoid it, get around it, and redress it. It's a long conversation for a long time.
I didn't get a response to the first part of that question, which was about continuing this conversation about being sustainable versus, or in addition to being regenerative. Sustainable communities and regenerative communities.
I guess I didn't understand your first question. I mean, can you restate it?
When I think of sustaining, and especially in the environment, are we able to keep sustaining what we have at that level of saying sustaining and acting on like we're going to keep it in place versus having initiatives that not only keep things in place, but actually move things forward, initiatives and not only structures, but also moves people forward as well. We have created a process, and I will use the example of affordable housing, and housing and health is intersectional for me. So if we say we have a housing that we want people to live in that is affordable, and the system, institutional system application is saying affordable housing is now subsidized housing. Now, subsidizing housing isn't the problem per se, but the way we apply it is we say you qualify for it, and then in order to keep it, you need to stay sustained at that poverty level to keep it. And so that's called subsidizing and sustaining people in poverty. Whereas if some of us are referring to equitable housing, and we say equitable housing, affordable is one of the values of it, but the key difference is versus sustaining in poverty is about people's livability and quality of life, and how that becomes more of a measurable process that is very important. So, yeah, so you will still have affordable housing, but it's not just providing a roof over people's house, but it will be, when we say regenerative, it's about investing. And so if we had a total investment lens for everyone versus we subsidize some, which is sustaining some, but I want to bring it back to environment. Can we actually do that in environment, just continually to say, because our words also has an application to the impact, of the work that we're doing.
I think I understand your question. So I'm gonna try to respond to what I think I understand, sorry. You want resilient housing. You want resilient communities. You want communities and structures within communities to promote health that we know is healthy and that will keep that individual functioning to an equitable lifespan. So it's not keeping them poor to keep in the housing, but it's providing them in a geography with structures that promotes public health, which is equitable on any measure. So one of the things that you can require in this resilient paradigm is that we don't have human beings living within 30 miles of a power plant unless those structures have been designed and built and verified to withstand that kind of pollution exposure to those humans within that geography and within that housing. That is resiliency, equitable resiliency.
Thank you. We may have time for one short question.
Actually, I wanted to leave people with a call for action. Sorry.
Oh, you're good.
I couldn't broadcast it to your mind quickly enough. But because I wish we had time for more questions, but I always, if I attend a session, I like to kind of know, well, what can I do instead of just keep it all in the head knowledge space. So I wanted to point you all to, there's some brochures on the back table with some information about the work that we've done as the Lung Association. We have our State of the Air report, which gives a report every year on the air quality, particulate matter, ozone for different major cities, and they have it for each state. So if you want to take a look at that, you can. And I'll post all of this on the app. And then we also have a report called Zeroing In on Healthy Air. It's all about electric vehicles, and it looks at the impact between that and health. And then some other information you can peruse. But I really want to encourage people, if you want to get more engaged in advocacy, if you're a health professional, join our Health Professionals for Clean Air and Climate Action. We also have a Stand Up for Clean Air initiative. That's another way of getting involved in advocacy, and both on the local level and the national level. And do either of our presenters, our panelists, have anything that they would want to leave people with as a call for action?
Yeah, myself, I just want to continue to advocate for those that are practicing any kind of religious or type of community, that you have a shared value, that there's power in that group of people coming together on this issue and building a community that will at some point even vote in a type of system that will actually help us all make the changes that we're talking about today. That there is an opportunity there, and I encourage everyone to think about that and reflect.
I'm going to support that recommendation. I'm Roman Catholic, so I'm always going to pivot to that. So I'm a third order secular Franciscan. Franciscans are very much into the environment. But I think regardless of your faith, tap into, as an individual, those initiatives that talks about environment and ethics and human health and human life. One of the things that I argued, and successfully to the Catholic Church, was that environmental health was a right to life issue. That every human being should have the right to be born with environmental health integrity from conception. You shouldn't be a child in the womb exposed to lead because of your geography. Knowing the destruction of your very human fabric, not just a child. I don't want to get too deep into epigenomics, but that child and his child's child. There's certain chemicals that once it's exposed to the child, it alters the DNA. And so we're talking about changing the very fabric of life by environmental exposures. It is truly a right to life issue, because every human being has a right to be born as a human being with full living capacity and not altered because of geography.
Yes, thank you.
I just want to say one last thank you to all three of you for being here today and for the incredible panel and for sharing the movie with us as well. Again, there's going to be a recording available of this session within the next few days, and that will be up on the app and available for the following 3 months. After this, there are mobile workshops starting at 1 p.m., so we have a 30-minute break, and those will depart from the Frick Forum, which is just right outside of this room. So you guys are all in a convenient place for that. Thank you again for being here.